All right, so welcome back to another episode of Medicine Mondays. Yours truly, Dr. Barry Pierre, and I was hoping to have a very festive post-holiday video discussion to talk about, but unfortunately, because news happens and things happen that come across my feed, I have to talk about it. So recently on The View, which is a very popular TV show, there are some comments about osteopathy and osteopathic medicine and not being a real doctor. Now, if this is your first time following me, let me tell you that this is probably a discussion that we've probably had over the years, multiple various times at multiple different stages as far as the DO versus MD debate. But unfortunately, when it hits prime time now, and I'm going to give my thoughts at the end. When it hits prime time, like I almost have to be that champion. Like, oh, like what is happening here? So today we're going to talk about why The View, and more importantly, I don't want to say The View, right? We're not going to disparage everyone on The View, right? But importantly, there's a host on The View, Sunny Hostin. Apologize if I'm pronouncing that name wrong, because again, I don't watch that show. Who unfortunately insinuated something about osteopathic medicine not being a real doctor in an effort to get a dig on former President Trump, right? So let's give some backstory. So the video clip, really the episode kind of starts out talking about how Trump may be having some issues or concern for cognitive impairment. We've talked about this before. We could dedicate a whole episode on that. And they kind of mentioned how Trump kept mixing up, former President Obama as well as current President Biden, and as far as when he was trying to put the blame on someone for something, right? And they showed a series of clips, right? Which, okay, cool, right? You don't have to convince me that former President Trump may have some cognitive impairment, possibly, allegedly. I'm not his doctor. Don't have to convince me on that. But unfortunately, to prove her point, right? Or really to try to call to task those who are in his circle who have given him the clean bill of health, she makes a comment that I know a lot of my colleagues, took it right on the chin for various reasons that we will talk about at the end. So let's watch her comment and let's hear some of my feedback, and more importantly, who's to blame? Where do we go from here? Because yes, it's good to have a quick bit of outrage. But more importantly, the next step is all right, how do we make it so it doesn't happen again? And more importantly, how do we make it so that the pre-med student who may want to be an amazing physician doesn't think, oh, you know what, I shouldn't choose to become a doctor of osteopathy because that's not real medicine. Let's just take the clip so you can understand what I'm going.
I think he's slowing down. His doctor, who is not a medical doctor, but a DO, a doctor of osteopathic medicine, there is a difference between the two, said that he is in great shape.
All right, so that was the clip, right? And again, she kind of goes on, but she doesn't really clean up what she says. She just kind of goes on the fact that this doctor gave former President Trump this clean bill of health about how he's in great shape, but it doesn't include things like his weight, his cholesterol, all these other things here, which again, I'm almost sure I've talked about it on the episode or live or somewhere. There's some recorded piece of material of me commenting on that. But what did she talk about, right? What drives some of our colleagues crazy? The fact that, one, she points out that his physician happens to be an osteopathic physician. That's one. Two, the fact that his physician, who just happens to be an osteopathic physician, is not a real doctor. Not a real medical doctor. Let's stop. Let's pump the brakes. Please, let's pump the brakes there, right? And this is where battles have occurred all the way down to the pits of undergrad and studentdoctor.net, all the way back then. And mind you, I'm talking about 2005, 2007 timeframe where people were arguing DO versus MD. And a lot of it has always been based on philosophy. And in my show notes, I'm going to give some descriptions. I have some links on, what is a doctor of osteopathic medicine, all that. I'm going to do all that, right? But I think here, especially for those who are, most of the people, especially people who are in earshot of, my voice or, have seen or watching the video, have either been taken care of by a DO at one point or the other sometime in their lifespan, right? The likelihood of it is kind of low that you've never been taken care of or been taken care of by someone who's a DO who's trained someone. Like it's very low, very low. So here we go again, unfortunately, insinuating, right? And again, like I said, yes, do we think former President Trump may have some cognitive impairment? It's possible, right? Allegedly. I don't know. I'm not his doctor. But to drive home that fact using the fact that his physician has to be an osteopathic physician and not a real medical doctor, that is where we have to pump the brakes, right? Because that is where we see that, oh, you know what? This person doesn't really know what an osteopathic physician is, right? Because to say an osteopathic physician isn't a medical doctor, now I have to ask you the obvious question, what do you think a medical doctor is? Right. And I think a lot of times in the general public now, and I'm going to tell you why I think this is, in the general public, we have issues where MD has been like, oh, that's a medical doctor, and DO is not a medical doctor. No, that's not the case whatsoever. MD is a person who went to an allopathic school versus DO is the person who went to an osteopathic school, right? The general public has no clue that an MD goes to an allopathic school and and learns and teaches an allopathic medicine. They probably don't have a clue on what allopathic medicine is from a definition standpoint, but that's beside the point. But they're all medical doctors. And unfortunately, the reason why you're getting a bit of an upswell from a lot of my colleagues and people calling for this host to at least apologize, or more importantly, just clarify what she was more insinuating at. I don't think she was insinuating that, because he's an osteopathic doctor that, he's no good at it. No, I think he was insinuating that, hey, the person in Trump's team is a dummy. Right. And not only is he a dummy, he gave this guy a clean bill of health when it's clear he should not have a clean bill of health. That's what the insinuation. But the unfortunate, matter of the truth is that he just happens to be a DO. And the reason why this hits hard is because as an osteopathic physician, even when you're a pre-med student, in fact, let's be real, even when you were a medical student, you had people making you think that because you went the osteopathic route, became a DO, that you were somehow less than the person who went the allopathic route, aka MD. You had people thinking that. So you had people who decided, you know what? I'm going to only apply to allopathic schools because I want an MD. I'm not even going to apply to an osteopathic school. You have people who were in osteopathic schools, and unfortunately, I know a few because they were in my class. They were my classmates who hated the fact that they were an osteopathic medical student. Absolutely hated it. And they would let you know that they hated it, right? And then when it comes to residency, which is a whole different ballgame, much different discussion now than even 5 years ago, where you had the option, hey, I'm going to go to an osteopathic residency or an allopathic residency. And you have people saying, I am not going to an osteopathic residency because I want to learn more. I want to train more. I want to be a quote unquote better doctor, right? So this isn't like, Sunny, like this isn't something that just kind of came off in just general public. No. There are people even within our profession of healthcare who have internalized this notion that the osteopathic physician, the DO, is not a real medical doctor, unlike the allopathic physicians who get the MD. And I remember I won't say his name. Right? I won't say his name. But I remember after, finishing up residency program, and even when I became a program director, like there was an attending, right? Mind you, I'm attending status. I'm already done. I'm already done residency. There were an attending, right, that we unfortunately had to deal with frequently, who used to consistently talk disparagingly on osteopathic residents. Mind you, I'm a program director full of osteopathic residents. And this guy is one of our attendings, but he would, because he was an allopathic, he would consistently talk down on the osteopathic residents, osteopathic medicine, and just the theory of osteopathy, right? Consistently did it, right? It was very weird to me, confusing to me, didn't understand it, but I understood where it was coming from. I understood that, yeah, this isn't something that this guy just happened to, wake up and feel that way. No, this is something that has been going on probably since inception. And unfortunately, you see it in broad daylight, right? You see, this host, right? I do not think, right? And I'm sure by the time this video comes out, I'm sure there's going to be a retraction, apology, something. I'm sure some statement's going to happen where she's going to apologize, say she didn't mean it, and I 100% agree. I do not think this was malicious. I just think that subconsciously, this is a train of thought that has been unfortunately continued to be ingrained in our pre-medical students, our medical students, our residents, right? And the general public, that for some reason, the DO degree is somehow less than the MD degree. It's just unfortunately ingrained. And like, who do you blame? Like, who do you blame when you try to figure out, like, all right, who is like at fault for what we're dealing with here, right? Who is at fault for, DOs, having to like work, quote unquote, harder, right, to make sure that they don't look less than their allopathic colleagues? I think a combination just kind of starts historically, right, where they didn't want osteopathic physicians kind of just in our country, right? It was not wanted, and it was seen as competition. It was seen as the enemy. And because it was seen as the enemy, there were a lot of things that were done to try to thwart the enemy, right? To try to discourage people to go to the enemy. And I can tell you all the time, as an attending physician, unless I happen to know your credentials, I have no clue whether you're an osteopathic physician or an allopathic physician. The general public has no clue if you're an osteopathic physician or an allopathic physician. I can assure you that. Right, the level of care and the training, right, is where it needs to be. Right, there is no the osteopaths get less, the allopaths. No, that's not the case. Right, there is no the allopaths have to be smarter. No, that is not the case. So, but unfortunately, when you have an instance like this, you have to stamp it out. So I don't want people, especially, and it tends to happen from within. I don't want my osteopathic colleagues saying that, like, hey, we as other osteopathic doctors are just kind of overreacting. You know what she meant. No. I'm not overreacting to the fact that I think she meant malicious intent. I'm going to overreact to the fact that I don't want the next person who's thinking, hey, I want to grow up to be a physician one day to look up and say, you know what? I remember there was a lot of controversy one day on The View about this person saying that an osteopathic physician wasn't a real medical doctor. I don't want to do that. I want to be a real medical doctor and decide, you know what? I'm not going to even choose that route. And then all of a sudden, let's say something happens, right? And they can't get into the school they want to get to. And there's plenty of other osteopathic schools that would love to take them. And now they don't even come. So now we've lost someone who would have been in our profession because they didn't want to be an osteopathic physician, which again means a hill of beans at the end of the day. Because guess what? Insurance companies do not pay you less because you're an osteopathic physician. Jobs are not going to offer you less money because you're an osteopathic physician. Hospitals are not going to not grant you privileges because you are an osteopathic physician. Like, it's real, and I hate to say it, it's really like this educational discussion that gets talked about on messaging boards, but in the reality, in the real world, means absolutely nothing. Means absolutely nothing. And trust me, there are plenty of allopathic physicians who make stupid statements. And, if you watch Real Physician Reacts, I probably highlighted a multitude of them, right? There's plenty of those who do that, right? I don't have to disparage the whole allopathic medicine profession if one of them makes a mistake or says something dumb or says something like, yeah, this guy has a clean bill of health. I don't have to disparage that. We don't want you to disparage all of osteopathic medicine just because one of us happens to say something stupid. That's all we're asking for. Like, that's all. I think that's all anyone can ask for. All right. Again, I expect there's going to be some type of statement, apology. I fully expect it because it usually occurs that way. And I just hate the fact that situations like this have to occur for people to realize, like, oh, I didn't know that about osteopathic medicine. Like, I hate that it has to get to that point, but it's on us, right? Those who are in the profession to continue to champion the profession, which is harder. I'll be honest, it is harder these days, especially because I did graduate medical education where our residencies are now combined. So we don't necessarily have an osteopathic residency anymore or it's just one residency. And from what I've seen in some of the osteopathic residencies, they've done more assimilating to the allopathic way of doing things than the osteopathic way of doing it. Because there is a difference, right? If you ask people who know and love their osteopathic physicians, they'll tell you, like, you know what? They're so holistic. They're amazing. We've cornered the market on being like this holistic physician, looking at the whole person. But like in general, our theory of practice focuses it on the whole body. Like, we can't just look at the musculoskeletal system. Like, we focus on a range of things, right? But again, that doesn't mean my allopathic physicians don't do that. That doesn't mean my allopathic physicians know less than us. It just means that we focus on something a little bit more. And that's how I want people to look at it. Not that the allopathic docs don't focus on the musculoskeletal system and how that may affect our disease processes and how that may present. It's just like, they don't do that. Some of the osteopaths, and not all of them, some of them do, and some of them kind of understand it. So I think that's where I'm here with it. Those are my thoughts, right? Again, I fully expect an apology from her or a statement from The View, something in that regards to say, I'm sorry, my bad, we messed up. Fully expect it. And in that instance, I know that it does mean that I have to do a better job at saying, hey, is your doctor an osteopathic doctor? In fact, maybe we might do an episode. Maybe we do an episode where I just say, hey, do you know if your doctor is an osteopathic doctor? Just to kind of bring, a little bit of good fame and discussion around osteopathic medicine. Because I hate the fact that when we're talking about osteopathic medicine, it's usually in reference to someone doing something dumb or making a stupid statement, and then I have to rebut. I hate to do that. Like, I want to be more proactive in saying, hey, the amazing, right, practice of osteopathic medicine is where it's at, and this is why I think you should be rocking it with us, right? So again, I am yours truly, Dr. Pierre. Thank you for sticking around. Make sure to like, subscribe to the YouTube channel. If you're listening to this on the audio, make sure you are subscribed to the podcast, and I'm going to see you guys next week.